Hi, Naomi. I am here to give you a report on my patient before I head out for the night. I have Jimmy, who is a 9-year-old male who fell at home last night while playing and experienced prolonged bleeding time, so he had to come into the hospital. Jimmy has a history of Hemophilia A, which is a genetic disease that causes a deficiency of the clotting factor 8. So when he falls or gets into or has injuries, he is at risk of more prolonged bleeding. Um, Currently, we have some lab values here, and I can tell you that his factor 8 level is at a 4%, which is extremely low because the normal range is 50 to 150. Um, his platelet count is normal though, which is also in in relation to his hemophilia A. Typically, the platelets are not affected. It's specifically this clotting factor. And his PT and PTT are both prolonged at the moment. So he's going to require close monitoring for additional bleeding, and we're going to need to continue to administer that um, uh, the factor 8 replacement through his IV therapy. We're going to notify. I need you to notify hematology on his status currently, and I need you to provide some education and discharge teaching to the parents just to reiterate some things. Um, we want to talk about the risks that he has with minor bleeding with minor injuries. So we need to make sure that he's staying out of contact sports and possibly seeing some physical therapy. We need to talk about the factor replacement therapy, which is very effective if used, um, and can really alleviate the length of some of these bleeding episodes. And how to administer the factor 8 via their prescribed protocol is very important. They might need a better emergency plan and better ways that they can manage his bleeding. And we need to make sure that they have some follow-up appointments with their hematologist for ongoing monitoring of those factor 8 levels, especially because his is currently very low. And we want to just make sure that they know how important some routine lab visits are so that they can continue to monitor those levels. So I appreciate you, and Jimmy's in room 8, and I will see you tomorrow.